There is a Chinese film whose theme has to do with an indigenous system of treatment called gua sha. The plot revolves around a grandfather who has learned this treatment from his forefathers and applies it for his grandchild. But in the process, there are some bruises on the child's body, and the grandfather is accused of harassing the child. Most hoary Western civilizations, of course, have their own systems, indigenous, of treatment and medicine. But the Western system tends to supervene and has been so overwhelming and ubiquitous that these indigenous systems have by and large been marginalized.
Living in the 21st century, we take for granted the elaborate medical system that takes care of our illness. The modern Western system of medical care includes rapidly advancing technologies for diagnosis and treatment, techniques for immunizing large sections of the people, and logistics for reaching medical care quickly to the needy. It is difficult to imagine that less than 3 centuries ago, none of this equipment and knowledge existed. Amputations were carried out without anesthetics, surgery without sterile tools, and very often by doctors with scant knowledge of anatomy and diseases. The history of modern medical science is a fascinating story of a series of men working in various scientific fields, whose studies, discoveries, and inventions changed the very core of medical knowledge and affected every one of us on this planet. Not very long ago, it used to be believed that diseases were the result of divine wrath. Combating sickness was the business of priests and magicians. Treatment consisted of expelling the evil, curing the errant soul, and restoring it to its proper habitat within the body. All over the world, different civilizations had different customs and rituals for curing basically the same illness. Ancient masters of Ayurveda were the first to provide an empirical basis to the study of diseases. They observed and categorized diseases according to their symptoms and signs, and based the treatment on their observations. The art of healing was taken to sublime heights with very elegant surgical operations and therapies. A variety of herbal remedies were categorized and classified. And even today, this system is found as effective as it was thousands of years ago. Charaka, the master physician of the court of King Kanishka of 2nd century AD, wrote the treatise on his understanding of the human body. Sushruta, the ancient master surgeon of 5th century, could surgically repair a nose that had been hacked away in battle, and even create a new one if necessary. The Chinese also evolved their own system of medicine. They studied the human body and identified hundreds of pressure points which served to heal various ailments. The most well-known branch of Chinese medicine is acupuncture. They also developed their own system of herbal medicines. Hippocrates, who lived on the island of Kos, off the coast of Greece, is considered the father of modern medicine. He lived around 500 BC. His greatest contribution is emphasizing the ethical basis of medical practices through the Hippocratic Oath. Then, for centuries, during the Dark and Middle Ages, Europe had no contribution to make in the field of medicine. Leprosy, plague, smallpox, and other epidemics swept across the continent, claiming many lives. Medical practices remained primitive, characterized by ignorance, superstition, and downright charlatanism. With Renaissance, the spirit of inquiry that characterized the times saw progress in the medical field. The human body had been considered sacrosanct and prohibited for scientific study. Gradually, dissection of dead bodies came to be undertaken. With this came a new understanding of the human body. With the dissection of human bodies, Western medicine established its tentative links with the physical sciences. Descartes' declaration that our body is nothing but a machine strengthened this new thinking, and the study of anatomy and physiology flourished. The British surgeon, William Harvey, came out with his discovery of circulation of blood in 1628. And he cleared many of the erroneous notions of that period about circulation of blood existing at that time. Sometime later, in the 17th century, a lens maker named Anton van Leeuwenhoek discovered the microscope. Through this handmade apparatus, he started looking at small creatures. Over the centuries, microscopes came to be improved upon, and man began the study of microorganisms. Bacteria got discovered, but mankind had to wait for at least 2 more centuries before Louis Pasteur could establish a relationship between these organisms and disease. Diagnosis and treatment still remained primitive. Even till the end of the 18th century, treatment consisted of bloodletting, purging, and branding with hot irons. The cure was often more painful than the disease. Surgeries were more of a torture than a treatment. Hospital and medical care remained as primitive as it was, without any progress. Appalled by the medical practices of his day, Samuel Hahnemann conceived of the homeopathic system. This was based on the body's ability to heal itself with minimum help from drugs. Homeopathic hospitals came up in various parts of Europe. Edward Jenner, who lived in England in the 18th century, noticed that milkmaids who had had an attack of cowpox are safe from smallpox. From this, he inferred that if you inoculate healthy people with cowpox virus, their chances of getting smallpox are considerably reduced. This was the beginning of the concept of vaccination in the West. Jenner introduced vaccination on a large scale as a means of protection against smallpox. Smallpox has been totally eradicated from this earth. Ignaz Semmelweis, who lived during the second half of 19th century, noticed that surgeons who washed their hands frequently suffered fewer losses during delivery. Even though he did not understand the reason, he exhorted physicians to wash their hands before each surgery and childbirth. The number of deaths came down. Joseph Lister went one step further. Based on his studies, he found that spraying phenol all over the surgical area prevented infection of the wounds. More and more antiseptic agents got discovered, and hospitals and surgical areas became clean, and hygiene became a part of patient care. It was Louis Pasteur who explained the scientific basis of hygiene and sterilization in destroying germs. He discovered the role of microorganisms in creating infection and diseases. And based on further scientific research, he discovered several vaccines, including one against rabies. The fact that germs and other parasitic organisms could cause diseases led to further research along these lines. Ronald Ross, a young British Army doctor stationed in Secunderabad, took up the search for parasites of malaria in mosquito. Working in a dilapidated lab with minimum equipment, he finally succeeded in discovering the parasite. And for his work, he was awarded the Nobel Prize for Medicine in 1903. Progress in the physical sciences during the 19th century led to the invention of the early diagnostic aids. Laennec invented the forerunner of the first tool, the stethoscope, in 1816. It took many shapes, and today it still remains a trusted companion to many practitioners. Stethoscope was followed by the invention of the ophthalmoscope by Helmholtz in 1815. The oriscope came in 1862. Laryngoscope was discovered by Gracia in 1854 for looking into the throat. The sphygmomanometer, the instrument used for measuring blood pressure, was invented by Riva Rossi in 1896. Eindhoven invented the electrocardiograph in 1901. Perhaps the most important discovery of the 19th century was the X-ray by Roentgen in 1895. This enabled doctors for the first time to photograph the inside of a living human body. These tools helped physicians in bedside diagnosis. Soon, medical professionals began to eagerly await technological developments in the medical field. The 19th century also saw great progress in hospital and nursing care. For this, humankind has to be thankful to the contributions of a great woman, Florence Nightingale. She revolutionized hospital care and made nursing a scientific and systematic profession. Twentieth century medicine can be seen as a quantum jump in three areas: medical and diagnostic tools, surgery and trauma care, and the use of antibiotics. Today, fiber optics technology has made possible the visual exploration of the stomach, duodenum, intestines, and other internal parts including blood vessels. Body imaging has advanced a great deal from the simple X-ray photograph. Now, we have ultrasound, CAT scanners, positron emission scanners, radioactive isotopes, and magnetic resonance imaging. We can see the internal functioning of almost all the organs. In the field of surgery and trauma care, the discovery and application of anesthesia was the first great step. Nitrous oxide and ether were first used for painless tooth extraction. Today we have a large array of anesthetic agents and systems that takes care of almost all the needs of a surgeon to help him to treat his patients. By 1940s, abdominal surgery had become common. In the 1960s, technology progressed so fast that surgeons became bold enough to open up the heart. Christian Bernard, a South African surgeon, made the first heart transplant. Pioneers like Harvey Cushing made great contributions to neurosurgery. 20th century also saw the development of vaccines for a long list of infectious diseases. Polio had been a scourge affecting millions of children. Jonas Salk discovered polio vaccine. Today we have a long list of diseases that can be prevented by immunization. Poliomyelitis, measles, mumps, rubella tetanus, diphtheria, and chickenpox are but some examples. Though the body could be immunized against germ attack, there was nothing the doctors could do against germs already in an infected body. Then came the great breakthrough, the discovery of antibiotic drugs. Alexander Fleming discovered penicillin towards the close of the Second World War, a wonder drug that saved humankind from many a bacterial disease. Selma Wakeman discovered streptomycin in the 1950s. This helped in the fight against tuberculosis. A plethora of antibiotics came in succession. These discoveries revolutionized the approach to medical treatment. The systematic testing of medicines, first on animals and then in controlled experiments on human beings, came about in the 20th century. Through this method, safe and tested medicines became available for nearly every disease. By the end of the 20th century, improved medical health care brought about a drastic drop in infant mortality and increased life expectancy all over the world. But today, we see the rise of a new epidemic, lifestyle diseases. It started with heart diseases, then followed cancer, mental illnesses, and many others. All these are said to be the result of the acquired lifestyle of the people, a sedentary life combined with unhealthy habits. The disease pattern had changed. And along with it, we have new epidemics like AIDS, Ebola, and related diseases challenging our healthcare systems. The scenario is harsher in undeveloped nations. Illnesses that are caused as a result of poverty, urbanization, absence of public health, and sanitation pose a problem here. To add to existing problems, diseases like malaria, typhoid, plague, and dengue fever, which had been under control, have started breaking out once again. The indiscriminate use of antibiotics has resulted in drug-resistant germs. On the one side, we have technological and scientific advancements in various related fields being applied directly in medicine. A great deal of research and development in molecular biology, genetics, and biotechnology also have helped in the practice of medicine, and people enjoy the benefits. However, the escalating cost of these therapeutic programs is now prohibitive. Today, they are beyond the reach of most of the world's population. The challenge of 21st century medicine is perhaps as important as the challenges of the 18th and 19th centuries. Medicine and healthcare must not become a luxury to be enjoyed by a few. The challenge will be to make it available to all who need it.
From the medical sciences, we move, or should one say, are catapulted into another realm, that of space, and man's exploration of that dimension. That in the next episode.